Hello, everyone. I'm Dr. Tushar Mehta, and today we'll be talking about the four P's of osteosarcoma. Well, the first P that we really need to discuss here is a very, very important P, and that P is basically the pain. Now, when I say pain, it means a severe pain, it means an intense pain, it means an out of proportion pain. A pain, something which is not, treated by the conservative routes of analgesia, the IM, the IV, the opioids, transdermal drug patches. Most of these things, they don't work. So that's the first P that one should know is intractable pain. The second P, which I'm sure most of you can make out here, is basically something which is called as pathological fracture. So, I mean, you all very well understand that the second P is pathological fracture, but why? It's a highly, highly, highly malignant bone tumor, and of course, it is going to lead to breach of the overlying cortex, and this typical fracture pattern and some internal lesion here is depicting pathological fracture. Now, the third P that I want all of you to understand is a very interesting P called as periosteal reaction, and it is a periosteal reaction along the Sharpie's fibers. So, let's try to understand first very quickly. So, we are dealing with something here called as cortex. Cortex is surrounded by the love and life of a bone, and that is what is called as periosteum. Now, this cortex is connected to periosteum with the help of certain fibers, and these fibers which are connecting the cortex to periosteum, these are known as Sharpie's fibers. Now, if you see a periosteal reaction along these Sharpie's fibers, so this kind of a periosteal reaction, it's a speculated interrupted periosteal reaction, and that looks like as if the sun rays are coming out of the sun or the sun has burst. So, I will say that the third P is the periosteal reaction. So it is typically a periosteal reaction along the Sharpie's fibers, and this periosteal reaction along the Sharpie's fibers is called as the sun ray or the sunburst, appearance. The fourth P that I want all of you to see today is again something related to periosteum, but this time it is not a periosteal reaction. This time it's a periosteal elevation. And this periosteal elevation is basically what we call as Codman's triangle. So see, you have a lesion here inside the metaphyseal, the distal femur. When it starts expanding, it will lift off the periosteum, and that lifting of the periosteum will give rise to a triangular reactive shell of the bone. And that triangular reactive shell of the bone is what is called as Codman's triangle. So, to revise it again for all of you, P for pain, P for pathological fracture, P for periosteal action along Sharpie's fiber, sunburst appearance, and P for periosteal elevation, Codman's triangle. So, more P's and E's and D's and F's coming soon. So, stay tuned for more of them. Thank you so much. God bless.